this way.
Hello everyone, my name is Hunter Pierce, and today I would like to discuss the cause and effects of long QT syndrome. For most people, everyday tasks such as exercising and doing everyday activities is easy. But for people with long QT syndrome, it could be life-threatening. According to the National Heart, Lung, and Blood Institute, Mayo Clinic, and my own personal experiences, long QT syndrome is nothing short of terrifying. Long QT syndrome is a heart rhythm disorder. Based off information from EKG Systems and Washington Heart Rhythm Associates, a heartbeat consists of waves known as the P, Q, R, S, and T waves. A normal heart rhythm looks such as this. It has a P, Q, R, S, and T wave. However, in somebody with long QT syndrome, their QT interval is almost double what a normal person's is. So you can see this is a normal, and this is somebody with long QT syndrome. Today I will explain to you the causes of what happens because of this life-threatening illness and what could potentially happen in anybody you know. The cause of long QT syndrome is either inherited or acquired and could be induced by certain medications. According to the National Lung, Heart, and Blood Institute, genetics is the main cause of this condition. Personally, this disorder runs in my family. My mom and all three of my siblings have this disorder, and it has been nothing but life-altering to us. Certain medications also cause this disorder, including decongestants, certain antibiotics, and diuretics, which are just medications that affect the fluid in your body. These medications can have the ability to prolong the QT interval in your heart, and they also have the ability to affect electrolytes in your body, which affect potassium, and that increases your QT interval in your heart as well. Long QT syndrome can also be acquired from severe diarrhea and vomiting, which also affects electrolyte imbalances in your body, such as potassium, and again increases your QT. Now that you know about long QT syndrome and its causes, let's talk about the effects and what happens to people that have this disorder. The symptoms that occur because of long QT syndrome generally happen because somebody is exercising or they're doing activities that increase their heart rate. And somebody that has long QT syndrome, their heart rate becomes chaotic when they're doing this. According to Mayo Clinic, there are 3 symptoms that occur within somebody that has long QT syndrome. The first symptom is fainting, and that is the most common symptom, and that occurs because the heart rate is very chaotic and the heart can't do anything except allow the person to faint or pass out, and then the heart goes back to normal. The next symptom is seizures, and that occurs because the heart does not perfuse enough oxygen to the brain, and that causes a seizure. And the next and last symptom is sudden death, and that occurs again because the body is not getting enough oxygen because the heart rate is chaotic, and that in the end leads to death. Sudden death obviously is the most frightening effect of this illness, because often people that die from long QT syndrome don't even know they have this until they have already died from it. The treatments of long QT syndrome include medications and an ICD, which is an implantable cardio defibrillator, which it acts like a pacemaker, and it is surgically implanted into the chest, and it can shock the heart back into rhythm when it goes chaotic and becomes life-threatening. Also, medications can be taken to keep the heart stabilized and slow so that it does not become chaotic as well. In my family, all of the people in my family that have long QT syndrome, my mom and all 3 siblings take medications called beta blockers that slow the heart rate, and also have ICDs to keep them from having the symptoms of long QT syndrome. As we have went over, long QT syndrome is nothing short of terrifying. This syndrome has many causes and negative effects in which I have shared with you. In general, the cause of long QT syndrome is a genetic mutation that is carried through families and causes fainting, seizures, and sudden death. Long QT syndrome is not something to be taken lightly because you may not even know you have it until it's too late. I want to thank you all for coming out, and I want to thank EKG Systems, Washington Rhythm Associates, the National Lung, Heart, and Blood Institute, Mayo Clinic, my family, and of course all of you again for listening in.